The health indicators of Pakistan, especially pertaining to women and children, are not very encouraging. In fact, if you actually compare the health indicators in the past 1 decade, then you will realize that the maternal mortality or the infant mortality has hardly moved 10 figures here and there. Out of nearly 1,000 children born in 1 year, nearly 95 die before they reach their first birthday. After every 20 minutes, one woman dies due to pregnancy-related complications. As you already know, polio is a very big issue and has become a very big issue. It's not just polio, it's other vaccine-preventable diseases like measles, which are spreading. Tuberculosis has come up. All these factors are basically due to health infrastructure which is not functioning very well.
There is no nearby government hospital in this area, and there are private hospitals which are very expensive, and these people, they cannot afford to go there.
And this is where hope has come in. The vision of hope is to provide secondary care to the areas where it is needed. What I mean by secondary care hospitals is that they are open 24 hours, doctors are available, surgeries are done. People don't have to rush to the main cities for cesarean sections, for appendectomies, to getting their gallbladder stones removed, or for incubator care for a neonate, where resuscitation services are provided, where blood transfusion is given, where x-rays are done, where laboratory care is available, where ultrasounds are done. And this is what 80 to 90% of the population needs. And we try to provide quality care to the people near their houses, in the rural areas, as well as in the urban slums. For a person to reach from a slum area to the main public civil hospital and stand for hours, it takes an hour to reach there and then stand for 2 to 3 hours waiting in the lines, and sometimes that becomes very life-threatening too. When you go towards the rural areas, you realize that the hospitals in the rural areas are not well equipped, neither with doctors, nor paramedical staff, nor equipment to provide these services. And people have to rush to Karachi to get these services.
Our charges are very nominal, and those who cannot afford, we don't even charge them. And if they require actually they require that surgery, that is life-threatening.
In addition, we have maternal and child health centers. These are small MCH centers which are run by lady health visitors, and they do antenatal care, they do deliveries, they diagnose cases, send them to the hospitals.
डॉक्टर अच्छे हैं इधर के, जिना में जाए कहीं जाए फिर बहुत धक्के खाने पड़ते हैं। इधर तो आते उसी टाइम डॉक्टर जो है ना कवर कर लेते हैं, भले रात को 12 बजे आओ, 3 बजे आओ, जिस टाइम भी आओ उसी टाइम डॉक्टर उठ जाते हैं।
And the third thing that we are doing is we are running a mobile clinic. Now this mobile clinic runs in the rural areas around Karachi, and it visits around 13-14 villages, and these are the villages where healthcare is not available, so the doctors go there and provides healthcare over there. So these are the services that we are providing in the health sector right now. Not only does Hope deal with curative health, that is treating the patients, also one of the things that our doctors do is counseling or motivation. And we do a number of health awareness campaigns, talk to the mothers and the children about the health issues, the preventive issues, talk to them about nutrition, talk to them about family planning, talk to them about antenatal care, about growth monitoring. This is especially true in the rural areas, where we not only talk in the hospitals, but our teams also go into various far-off villages and talk to the mothers. We train the traditional birth attendants so that the mortality and the morbidity becomes less and less. The health issues in Pakistan are numerous, and really over a period of time, we haven't really seen an improvement in the health issues. And one thinks that people should really make an effort to try to combat these problems, whether they be tuberculosis, whether they be malaria, whether they be pregnancy complications. And if everyone joins hands, even then it will take a long time to combat these So the government, the NGOs, the private sector, the public sector, everyone really has to work towards it.